Hi, I'm Dr. Brian Connor. I am the Medical Director at Healthy Ways Wellness Center. I'm also a chiropractor licensed in Connecticut and New York, a certified Dietitian-Nutritionist, and a certified nutrition specialist. I am certified in ART, which is active release technique, Kinesio Taping, MAT, which is meridian autonomic testing, and I am a certified medical examiner for DOT and CDL physicals. I am taking my exam in November to become certified in functional medicine. Pain is estimated to cost the United States up to $635 billion each year. This is more than the yearly cost of cancer, heart disease, and diabetes combined. So how do I treat this major problem that affects many people? And how does chiropractic, spinal manipulation, and adjusting help with pain management? Alright, so chiropractic, basically we adjust areas in the spine that are restricted. So we look for areas that aren't moving as well as they should be. We manipulate them with a chiropractic adjustment, whether it's by hand or with an activator, a tool, and adjusting that area can help increase the range of motion and decrease the pain at the same time. So other things that I use are orthotics. If you have foot pain, that can also cause knee pain and back pain, so I use custom foot levelers orthotics. Cold laser therapy, that's a red light, infrared light that goes on the area of pain and helps reduce inflammation and increase circulation and speed up the healing time. Same with PEMF, pulsed electromagnetic field. That also is good for reducing inflammation and increasing circulation and speeding up healing time. Hot and cold packs. So usually hot pack would be used more for chronic dull pain, and cold pack would be more for severe acute pain. Electric stim, I use IFC, which is interferential current. That is the best for pain relief. That's usually for 15 minutes. Shockwave therapy, that is a little machine that puts a pulse into the area of pain, and that is used for plantar fasciitis and golfers with tennis elbow. Ultrasound is basically a deeper penetrating heat, and I will use that sometimes with the arnica gel, and that usually is about 8 minutes of treatment, and I continuously move the ultrasound head around so it doesn't get too hot. Kinesio taping, like I said before, I'm certified in that. That is called the elastic therapeutic tape. It's used a lot in athletes in the Olympics. I would put the tape on the joints, that's in pain, the knee or the shoulder or the elbow, and I would put that tape on, and usually it lasts for a couple days. It's sweat proof and waterproof, so you can take a shower with it and it should stay on. ART, active release technique, that's kind of a myofascial release pin and stretch invented by chiropractor Dr. Michael Leahy, who is the chiropractor for the Broncos. Good for areas that have trigger points. The patient would move in a way I tell them to. Once I find the area that's in pain, I place my hand on there, and the patient would move, and that helps break up the adhesions in that trigger point. Thermostim, that is kind of a 3-in-1, kind of the multi-tool, so it can do heat or cold, kind of a Graston massage, and electric stim all at the same time. Arthrostim is basically a fancy activator that is more gentle, used for people who maybe don't want their neck adjusted. Vibropressor, that's basically a vibration massage, pretty self-explanatory there. CMTD, it's chiropractic manipulative therapy diversified. That's basically what you think of when you think of chiropractic is hands-on approach. I'm adjusting, the spine, the neck, the mid-back, the low back, so cervical, thoracic, lumbar spine. That's usually where you get most of the cracking from. That's basically what a adjustment or spinal manipulation is. F&D, which is flexion and distraction. That's where the table kind of moves up and down and left and right. It's good for kind of a good stretch of the low back, also good for disc herniations. Drop technique, that is good for SI, sacroiliac joint discomfort. Arnica and CBD, arnica gel is great. It's good for inflammation, pain, swelling, stiffness, bruising. CBD oil, also good for that as well. Essential oils like Valor and Panaway I use for pain relief. Turmeric, boswellia, glucosamine, and fish oil. Mainly I try to practice gentle chiropractic, so for people who are afraid to go to a chiropractor or afraid to get their neck adjusted, I tend to be more gentle, so patients, can leave knowing that, they get relief, but also it was done in a gentle way. My hours are Monday through Friday, 8 to 6:30, and Saturday, 8 to 11. Usually I'll do home and emergency visits and same day visits if needed.